guys, welcome back to my channel, and I would like to thank everyone who have subscribed to my channel again. Thank you. I love you guys. To those 85 subscribers, please stay connected for videos, and if you have any suggestions, please comment down below. And for today's vlog, you all know COVID season again. I mean, until now, the cases are still increasing and there are still lots of people dying, and it's really sad and it's really affecting everyone's lives. Excited to share with you guys tips or some information as a healthcare provider working in an emergency department of what do you have to do or what should you do if you have some symptoms, if you feel sick. Especially for those living in Australia, it's going to be winter soon, so definitely most of us will experience some symptoms with these weather changes. So I'm gonna start by giving you a disclaimer. So everything that I will share today is also based on CDC, based on some articles that I've read, and some of my experience as an emergency department nurse. So, shall we start? Alright, and to start our video, I will give you pointers of what you have to do when you feel sick and when you have some symptoms of query or could be COVID-19. Number one tip, if you have mild illness like cough, colds, or sore throat, flu-like symptoms, and it's very mild, you have to, number one, is stay at home. So stay at home, meaning to say you don't leave your house until it's necessary for you to go out. And public transportation, make sure that you're doing social distancing. And of course, while you're staying at home, you have to give yourself a rest. Keep yourself rested and keep yourself hydrated all the time. You have to keep in touch with your doctor or your GP doctor. It's really important to keep in touch and to know their numbers. And so when the symptoms persist, at least you know and you know who to call at home. But if the symptoms persist, you have to ring your doctor. And I will tell you later what are the symptoms or when is it necessary for you to go to an emergency department. Number two, if you have the symptoms, you have to have yourself isolated. Isolated means you can still stay inside the house with other people, but try to distance yourself from them. So you do the self-isolation. Maybe you're in a room, stay in one room, and the rest of your family will stay somewhere else in your house, but you have to self-isolate. Of course, it is for your protection and is also for the protection of your family members. Even the pets, you are not allowed to touch them or go near them because, of course, even pets can be affected with the disease. So you have to separate yourself from other people, basically. Number three is you have to observe your symptoms or monitor your symptoms. What do I mean by that? Common symptoms of COVID-19 are fever, cough, sore throat, normally all the breathing issues, but like a flu-like symptoms like chills and muscle ache, headache, all the runny nose and all those stuff. It could be a symptom of COVID-19. So you have to monitor your symptoms. If it's getting worse, or if you are like from having cough and then now you're having some breathing issues now, like difficulty of breathing or shortness of breath, then that's the time you have to ring your doctor. Ring your doctor first. And that is actually my number 4. Call the clinic and call your doctor or whoever your healthcare provider before you go there. Before you go to clinic or before you go to to whatever facility that you're about to go, please call them, because the thing is that we don't also want them to get infected as well. So you have to ring them ahead of time, and of course to verify if your symptoms needs some physical assessment. In Australia, there's a telemedicine, there's some phone consultation nowadays, and which is really convenient for patients. So better ring them first. Number five is to wear mask. Wear mask. Not all the time, but I will tell you, if you are alone and you are alone in a room or alone in your house or alone somewhere in your car, you don't really need to wear mask, because that defeats the purpose anyways. You just wear your mask if you are with other person or you're outside your house in a public place. Basically, you just wear it when you're around people, and even when you're around pets as well. Also, you have to try to maintain the 6 feet away policy or 6 feet distance, because of course, as you all know, it is a droplet precaution. So that means when you distance yourself, less chances of you getting the droplet or getting infected. Or number 6, you have to wash your hands. Wash your hands as frequent as you can. So washing your hands, the best option to wash hands is soap and water, and it should be 20 seconds, my dear. 20 seconds. And also, I remember when I was doing my board exam before, they always have the question, which is the most important factor when you're doing your hand washing? And I still remember the answer to that question. The answer is, because there's an option, could it be a friction? Could it be the soap? Could it be the longer you get, the most effective hand wash you get? It could be the time. So the answer to the question is that the most important factor when you're doing your hand washing is friction, or how you really wash your hands thoroughly. And also, when you're washing your hands, sanitizers are not good enough when there's a visible dirt on your hands, especially when you touch something and you really see the dirt. You should be washing your hands with soap and water, not just hand sanitizer. We still in the healthcare field, we still use the sanitizer, especially if it's not visible dirt. So it's still helpful though to avoid touching your face with unwashed hands. So we're not saying you can't touch your face at all. As long as you wash your hands, maybe you could touch your face. If it's itchy or whatever, you could touch it, but you have to wash your hands first. Cool. Now, I'm gonna tell you, when are you supposed to go to hospital or to emergency department if you have the symptoms of COVID-19. Number 1, please don't go to emergency department if you have mild symptoms. What do I mean by mild symptoms? Coughing, just coughing, without any breathing issues. So that's gonna be my main number 1. Number 1, you go to emergency department when you have breathing issues. Breathing issues meaning to say difficulty of breathing, shortness of breath, you can't talk anymore, like you can't talk in full sentences anymore, you are gasping, you have like an increased work of breath where you can see your accessory muscles. Number 2 symptoms, if you have chest pain from breathing problems or whatever, or chest pain from like a cardiac issues, you really have to run to emergency department wherever it is located, whether it's on the right side, left side, central, going to the back, especially going to your arms, to your jaw. Please do go to emergency department. Number 3 is if you have some new confusion, or for example, in an elderly, they are normally confused, but then there's additional like it's getting worse or they are deteriorating, especially if the confusion is getting worse, that to the point of confusion, getting lethargic, getting unresponsive, especially, oh my gosh, you have to run and you have to bring the patient to emergency department. Number 4 is if your lips or your nail beds turns to blue, or even your skin. If your skin turns like pale or whatever, or there's some discoloration going on, please go to emergency department. And anyways, it's a case-to-case basis as well. So that's why you have to ring the helpline, or you have to ring the hospital. Each country has their different styles of managing COVID-19. So if you are like here in Australia, you have to ring helpline first before you go to hospital. Or if you have the cases like the one that I've mentioned earlier, better just go straight to hospital. But if you can still manage it, you could ring them just to verify if you go to hospital. Otherwise, we don't want you to risk yourself going to the hospital and be, it's also a risk. Like when you go to hospital, you can get the virus in there, of course, because everyone goes in there anyways. So it's better for you to call first. It's for your protection. It's for the healthcare provider protections as well. So I wish you all the best, and I hope we all don't get the COVID anyways. I hope it will stop, and so that we can carry on with our lives. And for those who are affected by COVID, my heart is with you guys. So that's it. Thank you for watching, and please, if you have anything to add, please comment down below. Thank you. Bye.